Hello, my name is Aisling Lee and I'm a fourth year occupational therapy student. In this audio recorded infographic, I'll be sharing evidence-based information with the general public about the role of occupational therapists and how occupational therapy strategies can support individuals living with osteoarthritis, or OA as I'll refer to it throughout. OA is a condition that affects millions of people around the world. It is the most common form of arthritis in adults over the age of 45. OA occurs when the protective tissue that cushions the ends of bones in the joints begins to wear down over time. This can cause pain, stiffness, swelling, and difficulty with everyday activities, such as buttoning a shirt, using kitchen tools, or walking up and down stairs. Although OA is a long-term condition, it does not mean that people must live in constant pain or give up the activities that matter most to them. The good news is support is available. Occupational therapy is a healthcare profession that focuses on helping people do the things they need and want to do, even when living with health challenges. The role of occupational therapy is to use practical strategies to support people in managing pain, improving independence, and maintaining their quality of life. These strategies are not one size fits all. They are tailored to each person's lifestyle, goals, and needs. Before we explore how occupational therapy can help, it's important to understand the factors that can increase someone's risk of developing OA. First, age plays a major role. As we grow older, our joints naturally go through wear and tear, making OA more common in people over 45. Carrying excess weight also puts added pressure on joints, especially in the knees and hips, which can lead to faster joint damage. Genetics can be another factor. If your parents or grandparents had OA, you might have a higher chance of developing it yourself due to inherited joint structures or other genetic traits. Previous joint injuries are another contributor. Even if an injury seems to have healed, that joint may still be more prone to wear and tear later in life. Repetitive movements, such as those done during work or hobbies, like kneeling, lifting, or typing, can also place stress on joints over time. Interestingly, women are more likely than men to develop OA, particularly after menopause. Finally, weak muscles around the joints can increase the load placed on the joints themselves, leading to faster damage. The stronger the muscles, the better they can support and protect the joints. It's important to remember that having one or more of these risk factors doesn't guarantee that you'll develop osteoarthritis. However, knowing what contributes to OA can help us prevent the steps and seek out early support when needed. Now that we've looked at risk factors, let's briefly talk about what causes OA to develop. OA often results from a combination of three main categories: genetics, environmental factors, and life experiences. Genetically, some individuals are simply more likely to develop OA due to inherited traits, including joint structure or how their body repairs tissue. Environmental factors also play a role. People who work in physically demanding jobs like construction, farming, or manufacturing are more likely to put repeated strain on their joints. Limited access to early treatment or healthcare services may also delay diagnosis and management, which can worsen the condition over time. Exposure to certain substances in industrial settings has also been linked to joint damage. Life experiences, including joint injuries, excess body weight, and low levels of physical activity, can add up over time. Injuries from sports or accidents can weaken joints, and carrying extra weight increases the strain placed on them. While it might seem like avoiding movement protects the joints, low physical activity can actually lead to weaker muscles and stiffer joints, which increases the risk of OA. Now that we have a clear understanding of what OA is and what contributes to it, let's look at some statistics. In Australia alone, over 2.1 million people are living with OA, and globally, more than 600 million people are affected. These numbers highlight just how common this condition is and why it's so important to find effective ways to manage it. This is where occupational therapy can really make a difference. The most evidence-based occupational therapy strategies for managing OA fall into 5 main areas: cognitive behavioral strategies, splinting, assistive technology, patient education, and physical exercise. Cognitive behavioral strategies help people manage the emotional side of living with chronic pain. They involve learning to respond differently to pain, using problem solving relaxation techniques, and positive thinking to build confidence and reduce stress. Splinting involves the use of supportive devices, usually worn on the hand or wrist, to reduce joint strain. Splints can help rest a painful joint, supporting it during an activity, or improve its alignment to prevent further damage. Assistive technology refers to tools that make everyday activities easier and less painful. These can include jar openers, tap turners, utensils with larger grips, or long-handled aids for reaching or dressing. These devices help reduce the effort required for tasks, protect the joints, and maintain independence. Patient education is another key part of occupational therapy. Learning how to plan your day, avoid overloading joints, use proper body mechanics, and pace yourself can go a long way in managing OA. Education empowers individuals to make informed decisions about their health. Lastly, physical exercise is crucial. Movement helps keep joints flexible and muscles strong. Occupational therapists can recommend safe, low impact exercises tailored to your ability and goals, so you can stay strong and active without causing further joint strain. Many people benefit from a multimodal approach. This means combining two or more of these strategies to get the best results. For example, someone might use a splint, make changes to their daily routine, and follow a gentle exercise plan, all working together to improve comfort and function. Here are some evidence-based interventions as follows. Zhu et al. 2025 explained that using digital tools like websites and apps helps people learn how to manage pain and stay active. These tools, especially those based on behavior change techniques, led to less pain, better movement, and more confidence in self-care. They were most effective when supported by healthcare professionals such as occupational therapists. This shows that digital support can be both accessible and effective in managing OA. Wind et al. 2022 found that wearing a soft hand or wrist support for just 3 weeks led to major improvements, a 77% increase in daily function and a 61% drop in pain. These types of supports offer a simple and non-medication based option to ease pain and help people with hand OA continue their everyday activities. Gensei and Tezel 2020 studied the use of thumb supports over 6 weeks and found that people experienced less pain, improved strength and function, and were highly satisfied with the results. This shows that splinting can be a valuable part of hand OA management. Bartholdi et al. 2024 explored the use of heated mittens for 6 weeks. While they didn't find big changes in movement, people reported a noticeable decrease in hand pain, showing another gentle at-home option to support joint comfort. Wind et al. 2022 also reported on cognitive strategies, such as phone-based therapy, that helped people sleep better, feel less anxious or depressed, and better cope with pain. Improvements in sleep and mood lasted for up to a year, showing long-term benefits. Teeter et al. 2022 found that a 3-month occupational therapy program with education, exercises, and hand supports helped reduce pain, strengthen hands, and improve daily function, even helping some people avoid surgery. Sheeran et al. 2024 and Juff et al. 2021 both studies showed that combining education with tools and exercises helped people manage OA more effectively, showing decreases in pain and an increase in OA management. Darlow et al. 2025 highlighted that when education fits the person's values and beliefs, it encourages long-term self-care and physical activity, increasing everyday function and life well-being. If you're wondering how to get support, the first step is to speak to your doctor. They can help with pain management or refer you to an occupational therapist. You may also be eligible to participate in a chronic disease management plan, which provides up to 5 subsidized visits per year to an allied health professional, like occupational therapy. This can make access to care more affordable. For further information and trustworthy advice, the Arthritis Australia website, which has excellent resources. If you're watching this video, you're likely accessed it through the QR code on the infographic. Thank you for taking the time to learn more about the role of occupational therapy in OA. I hope this information has helped you understand the condition better and feel more confident about the support options available. Take care of your joints and take care of yourself. Help is available, and if you don't have to manage OA alone. Thank you for listening.